When I began my veterinary career in 1985, I diagnosed 1 to 2 cancer cases a year. Today in 2018, I am seeing over 10 cases a week, and the numbers are rising. Current statistics for cancer in cats is 1 out of 3 cats will get cancer. The following case demonstrates that when we correct the conditions that lead to cancer, cancer can be eliminated. Meet Little. Little was born in 2003, and at the time I made this presentation, Little was 15 years young. In 2016, Little's owners noticed a growth forming in the left eye. The mass grew rapidly, and the owners took Little to their veterinarian. Like many cats, Little was eating a processed food diet, basically a kibble. Little underwent surgery to remove the mass. Unfortunately, nothing was done to address the root cause of why the tumor grew, and the mass grew back with a vengeance. Little underwent a second surgery to remove the mass again. Sadly, nothing was done to address the root cause of the disease, and within weeks, the mass returned. Little's owners returned to the veterinarian for the third time. This time, the owners were told nothing more could be done. They were told that the tumor was going to grow into the brain and euthanasia was recommended. Little's family was not willing to accept that nothing more could be done, and they came to me for a second opinion. This was what the tumor looked like at presentation May of 2017. I was unable to determine the extent of the tumor, where it was originating from, or if the eye could be saved. The decision was made to proceed with surgery, though no one was sure if the outcome would be a positive one. After removing the tumor, the challenge was dissecting out as much of the tumor tissue as possible. At this stage, I still could not see the eyeball. After tedious dissection, removing as much of the tumor as possible, I was delighted to see that the tumor involved the tissue around the eye, but did not involve the globe itself. I was hopeful we could save Little's eye and he would be visual after surgery. I knew I had not removed all of the cancer tissue, so I packed the area with a herb that is designed to remove and kill any remaining cancer tissue. After a period of time, the herbal product was carefully rinsed off and Little recovered from the procedure uneventfully. The mass was huge and had been growing under the upper eyelid for a long time, stretching it to accommodate the mass. I was not sure the eyelids would shrink back, but I had high hopes that with combined ozone and laser therapy, the tissue would return to normal. Little went home doing great. We addressed lifestyle changes that helped prevent the tumor regrowth. Little was converted to a species-appropriate raw food diet and had a variety of supplements designed to not only inhibit growth of the cancer tissue, but to restore normal cellular function. During the 3 months that we were treating him, Little received 3 ozone therapies. 1 week post-operatively, the swelling was reducing and the area was healing very well. Little's family and I are thrilled to report that 8 months later, there is still no evidence of the tumor returning, and he can see out of his left eye.